Dr. Eric Kelly again from Glenmire Chiropractic Clinic here in Cork. Now today, as you can see, I'm at my home. Today I'm going to discuss to you something I get quite a bit asked a lot in the clinic is, Doc, what's the best position to sleep in? And it is a very valid question because a lot of people don't know what the most recommended sleep position is. Now, we all know there's three positions that most of us sleep in: side, back, and stomach. So I'm going to start with number 3, the last one, stomach sleeping. I'm going to just start this by saying, do not sleep on your stomach. Okay, there's no good way of telling you how to sleep on your stomach. You cannot stand in a neutral position or lay down in a neutral position like you can stand, because you'd suffocate yourself, because your head would be in a pillow and you wouldn't be able to breathe. So your head turns all the way to the side. Your head's going to be laterally flexed to the side. Now your toes also can't be straight, so you got to rotate your lower body so that your feet aren't digging into the mattress, and your arms generally go above your head. Now, does this look comfortable to any of you? It definitely doesn't look comfortable to me, and it isn't comfortable to you guys, which is why you'll start waking up with neck pain and headaches and shoulder discomfort, low back stiffness. You roll out of bed, you won't feel like you're well rested. It's because it's the worst position to sleep in. So my recommendation on sleeping on your stomach: do not do it. All right, okay, so that's the sleep one done with for the stomach. Now, the other two are sleeping on your side, which I highly recommend, and then the other one is sleeping on your back. So we're going to go into a clip here with myself and Monica where I explain to you how you should sleep on your side and how you should sleep on your back, using the help of an assistance of a pillow, actually pillows, plural, and why you should sleep in those positions. But I highly recommend sleeping on your side first, your back second, and never recommending sleeping on your stomach. So here is the clip of me and Monica walking you through your proper sleeping positions. Follow it step by step, and I know it's helped me and it's helped Monica, and I know it will help you. Okay, so here we are with Monica, and what we're going to do is we're going to have Monica here help assist us to show you what I was talking about with proper sleep ergonomics. So there's one big thing that you want to kind of picture when you're sleeping on your side. So as Monica's laying here now, we're using the assistance of a cervical pillow, so it has a big bump and a little bump. So you want the support from the shoulder to the neck with the bump in there to support the neck, so there's no light getting through underneath the neck. The pillow is properly down to the top of the shoulder, and there's nothing into the neck where there's no gap. So all the weight is supported by the pillow. Now, the other thing that you want to think about is, 1, having the pillow in the proper position, but 2, having your body in the proper position. So the biggest thing to picture, and it always helps to have somebody either show you or watch you as you lay down, or do this with yourself, just take a video and then see what alignment you're in. But the biggest thing is the nose, the chin, and the belly button all need to be in a nice straight line. So as you can see, Monica's belly button would be at this height, Monica's chin is at this height, Monica's nose is at that height. So the angle is a little bit down here, but you can see her nose, chin, and belly button would be in a straight line there. And that would keep the spine in a neutral position. Now, if her nose and chin and belly button are in a straight line, it's as if she's standing up and down. Now, if the pillow is too big, her head's going to be laterally flexed to the side. So if we just take this pillow and put it underneath the head, you're going to see what I mean. Now, if you take a look at her head now, her nose and chin is pointing down here, well below her belly button. So the angle of the neck is actually laterally flexed. So if you stood like this for 8 hours, because that's on average of how long you sleep, imagine how tight and stiff your neck would feel after 8 hours standing with your head to the side like this. So by removing the pillow, having the head at the proper height with the nose, chin, and belly button in a straight line, that will help. Now, as you can see, we have this. It's always advised, people are saying, hey, what do I do with my arms? My arm's always above my head, underneath. Well, if you grab a pillow and you hug into your pillow, that will keep your arms in a nice stationary position all night. So that way your arms aren't flailing around, or you won't elbow your partner, right, Monica? So you won't elbow somebody, your arms are nice and tucked, and you're just comfortably hugging into that pillow. Now the other thing that you can't quite see, maybe because the color, she's got a different color pillow, but there's a black pillow here between the knees. So if I take it out, now her knees are together. So what that does, when you stand, you can see there's a gap in my legs here. If I stood with my legs together, that would put pressure on my low back, because the pelvis and the hips need that space apart. So by putting a pillow between the knees, this also then takes the pressure off the low back, which keeps the lumbar spine, the low part of the back, in a nice neutral position. So if the legs are apart, that's a neutral position. If the legs are together, well then that's closing in on the pelvis and the hips, and it's making the hip girdle rotate inwards, which is going to cause a bit of pressure on the low back. So you want the pillow between the knees, to recap, to keep the pressure off the low back. You want a pillow hugging into it to keep your arms from moving around all night. And you want the nose, the chin, and the belly button in a straight line. And you also want a pillow with the proper support into the neck. And you want the pillow flush with the shoulder, not pillow ending by the ear. Okay, now that's sleeping on your side. So next we're going to move to the low back. Okay, so now we're going to move into laying on your back. So I would recommend sleeping on your side first, actually for one big reason. When you sleep on your side, it can actually help with limiting snoring. When you sleep on your back, the pharyngeal here has a collapse to it, so it actually compresses it. So a lot of people, when they sleep on their back, will snore more because the airway in the throat, gravity is collapsing it. So if you have a snoring partner or somebody who snores a lot, it's always best for them to sleep on their side, not their back, because they'll tend to snore more. So that's in a research article that I can actually post below. I'll probably post that below for you. But however, when you sleep on your back, that would be the second spot that I want you to sleep on. First would be your side, try to get that comfortable. Second would be on your back. Now, same kind of rules apply, but with a little tweak to them. So the pillow again needs to be flushed down to the shoulder. So the pillow has to come all the way down, flush with the shoulder, so that the pillow isn't ending halfway up the head or halfway down the neck. It wants to be all the way down, supporting the curve of the cervical spine. So the curve on the pillow sits nice and neat into the curve of your cervical spine. But when we're talking about on your side, the nose, chin, and belly button being in a straight line, when you're sleeping on your back, you want your ear, your shoulder, and your hip in as close to a straight line as possible. So by achieving that, that will again keep your spine in a neutral position. When you're sleeping on your back, if your pillow's too big, well, your head's going to be flexed forward. Or if the pillow's too small, your head's going to be extended back. So for example, if we take this pillow and place it under Monica's head again, now you're going to see her chin is tucked into her chest. So now her ear and shoulder again is pointing down below the hip. So that's going to put a lot of forward pressure on the head. So if I stood like this for 8 hours, I'm pretty sure that's going to cause me some problems. So again, you don't want to sleep for 8 hours with your head flexed either. So without the pillow, the head sits in a neutral position for the spine and the throat to allow proper airway passage. And the pillow in the chest to hold on to, because sometimes when people sleep on their backs, their arms are going all over the place, slapping people behind the head. But if you have it here again in front, that's a more neutral position, takes the stress off the shoulders, which the muscles then also that go up into the neck are taken care of. So just to recap, again, the pillow, actually we didn't touch on this one, but the pillow needs to be under the knee again. So you can see there's a pillow here again, so there's a slight bend in the knees. You need the hip, shoulder, and ear in a straight line. You want to hug a pillow just to keep your arms under control, and you want this pillow flush underneath the neck to the shoulder height, so that the ear, hip, and shoulder stays in a good position, supportive, and that's your good night's sleep. So no snoring, no partner slapping, and a good night's sleep. Okay, so that's our sleeping posture positioning. So just take those tips into advice, practice them. One big thing to do and to remember when you're going through this is you will not be able to sleep the whole night through in this position the first time you try it, nor the second, nor the third. It will take weeks for you to make this a normal posture habit. So it takes time. You got to be patient with it. So if you wake up and you notice a pillow's on the ground, the one underneath your knee is kicked over, your arm's off to the side, immediately put your back into your start position as you see again, and just start to go back to sleep in that same position. That way, every time you wake up, you put yourself back to sleep in the proper position. It becomes more of a habit, and that's all posture is. Posture is just a habit. So you need to create a good habit. I trust you can. So work on these tips. This has helped us out a lot, so it will help you a lot. I know that personally. Okay, thank you very much. And me and Monica will be talking to you again. Thank you.